Today I'm showing you 3 strategies to relieve round ligament pain in pregnancy. But before we get started, make sure you subscribe to my channel so you don't miss any of my future releases for a healthy pelvis throughout your maternity journey. Round ligament pain is experienced as a sharp pain that can be on either side of your belly bump or sometimes on both sides. You have 2 round ligaments, one on the right and one on the left, and they start from your uterus and connect onto the pubic bone here at the front and on the labia majoris near the vaginal opening. As your uterus gets bigger, those ligaments get stretched out and under tension, and they can cause pain, especially in the 2nd and 3rd trimester when your bump is getting bigger, but some people even have that type of pain earlier in their pregnancy. The 3 strategies to relieve round ligament pain I'm sharing today all have the same goal of giving some slack to the round ligament in order to relieve the pain. You may want to use a combination of these strategies or just try them all and see which one works best for you. My first strategy is to gently apply pressure where you feel that sharp pain on the belly bump. For example, if you're feeling the pain on the right side of your belly button, you'll apply gentle pressure right there towards your spine, and it will give a bit of slack to the round ligament in order to relieve the pain. Continue to apply pressure for as long as the pain is there, and once it's gone, you can let go. Now make sure you're using gentle pressure. We really don't want to apply any hard pressure on the uterus during pregnancy. If you're aware of which movement triggers the round ligament pain, you can use the belly pressure technique as a preventative strategy to avoid round ligament pain before it comes on. For example, if you know that it often comes up with standing up from a seat, apply pressure on the belly bump before standing up. The second strategy is to hug your core with your abdominal muscles. A bit like we did with the belly pressure, it will give the round ligament some slack so it's not under tension, but this time we're using our deep core muscles called the transverse abdominal. To engage the transverse abdominal, picture hugging your baby with your core and observe how your bump moves towards your spine. Practice a few times to get really comfortable with this movement. Now you can use this activation next time you experience round ligament pain, or again as a preventative strategy before initiating a movement that you know triggers symptoms. And the last strategy is to use a belly band support. I recommend it especially if your round ligament pain is not clearly associated with a movement in particular, but it's kind of like randomly throughout the day, or like even some people like feel it like constantly. So if it's bothersome enough for you to invest in a belly band, it can be really worth it. The belly band will offer you continuous hug to your bump to reduce tension on the ligaments. And by the way, it's good for many other reasons too. I've recommended for different symptoms on my channel, like hemorrhoids, back pain, what have you. So that can be a really good investment for other symptoms as well. So if you're interested in looking at different options for belly bands, I have reviewed a few of them in one of my videos, and I'll link it in the description below. Now, if you're in your 2nd trimester, it is the perfect time for you to get started on pelvic health education for an empowering birth experience. So grab my free prenatal book in the description below if you're into that. I would love to be your coach through this journey. All right, I hope these tips will help, and thanks for watching.